We will now show how to apply the positioning sling from a lying position. The Human Care Positioning Sling is a sling for turning, repositioning, and lateral transfers. This sling comes in single patient use and reusable materials that can be left under the patient. Always make sure to review guidelines and recommendations to help choose the right sling appropriate for your patient. The correct orientation for the sling under the patient is with the label facing up and away from any contact with the skin, like this picture. The patient should be placed like this so that the center of the sling lines up with the patient's spine. To apply the sling, gently roll the patient onto his or her side. Place the sling on the bed beside the patient, keeping one side of the sling even with the edge of the bed. You can line up the sling slightly above 1 to 2 inches, the top of the patient's head. Gently fold straps under and begin to press down on the edge of the sling and slide under the patient. Roll the patient back over onto his or her back and gently pull the edge of the sling through with the palms up and keeping the knuckles on the bed to prevent any skin shearing. The edge of the sling should be lined up with the edge of the bed, as this sling is designed to fit the width of a typical hospital bed. When lifting with a 4-point hanger bar, make sure to orient the hanger bar so the longest width is head to toe and not across the shoulders. 2 loops will be attached to each of the 4 hooks. Hold the lift away from the patient's face with one hand as you raise it above the patient's head. As you begin to lift, pause when straps tighten to check that all the lifting straps are securely attached to the hooks. Continue lifting the patient. It is recommended to always maintain one hand on patient during movement for safety. Thank you for choosing Human Care.